really struggled with this whole name tag. Yeah, I wrote it on the wrong side. And then I put my backpack.
Yeah, it's a good then, Peter, how are you? We get to see each other. My cousin
Probably beat me here.
He did, so it's a nice amount of time.
Yeah.
He is not. Is anybody in the room right now?
No, I
He's
can't
at
allow
childcare
hybrid.
drop off today.
Oh, really?
Tuesdays and Thursdays he does drop off.
I did when I'm recording this, like the office.
Yeah, you know, at the end of the night,
Like,
so
we're-
when they're showing up, how they're introduced.
Yeah, so
Things are only fine through those.
Yeah.
So I onboard a lot of students who are like, this is the first time we're job. And I'm like, you're gonna do great. Yeah.
Mm-hmm.
We're talking about like meetings with it.
Good morning, everyone. My name's Ashley Cassiello. I am the senior consultant for workforce development at U Chicago Medicine, and I'm a member of the CHWC steering committee. So thanks everybody for coming here today. So some housekeeping before we get started. The Wi-Fi is posted kind of around the room if you need access for that. Bathrooms are outside of the office and down the hall past the elevators to the left. The bathroom code is posted here and also on some flyers kind of around the space. So if you need to use the restroom, that's where you can go. April will be passing around a sign-in clip-in. So if you could please sign your name with your name and your organization, we'd appreciate it. This session will be recorded. So as you see with the Zoom room, we will be recording today. There will be breakout sessions starting later on, and these breakout sessions will not be recorded. So just one thing to be aware of. We'll have a quick break, kind of coming up at the top of the hour, kind of closer to 10. And feel free to grab breakfast. If there's still food left over once we conclude today, feel free to take some stuff home. So please eat. Yes. So we have a number of folks joining us today, and while we don't quite have time to do solo introductions, could you raise your hand if you are a member of an employer partner institution? A hospital. Hospitals. Oh, there we go. Thanks. And how about training partners, training and education partners? Awesome. And how about community organizations? Did I miss anybody? Thanks. Well, glad to have everybody here. Really excited to see a good mix of the different partners here. And so the Chicagoland Healthcare Workforce Collaborative, just as a reminder, our mission is to unite employers and industry partners in order to provide inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations, and develop innovative responses to the developing needs within the healthcare industry. We are employer-led and we are local and targeted. So we focus on recruitment efforts within local communities and specifically within communities with higher concentrations of unemployment. We focus on education and training and how we can bridge the gap between what these community members need and the jobs that we have available within healthcare. We also focus on retention and career paths to that healthcare workforce and figuring out, again, whether it's education or training from a formal perspective necessary to kind of bridge that gap. So I'm going to pass it over to April to get us started with the agenda.
Thank you so much, Ashley. Can everyone hear okay? Awesome. Thank you all so much for being here. I really appreciate it. I'm so excited that this is our first in-person meeting since I've been here, which is since November of 2020. So we haven't been in person since 2019. Thank you for being here. We have 3 presentations in this hour. We are very lucky to have Clarasol from Senator Durbin's office here and Natalie with Rush to give us a little update on Senator Durbin's HEAL initiative. We're in phase 2 of that initiative. They'll present some of the outcomes and talk about the goals moving forward. Then I will give an update on our nursing assistant program, which we are launching with Good Jobs Challenge grant funding. And finally, then we'll have an update from our Youth Pathways Committee and some of the activities that are going on with that group. At the end of this hour and 15, there's also time for community announcements. So if you have anything you want to share with the group, I encourage you to do it then. We'll have a 15-minute break, so please help yourself to some more food. And then we will have breakout sessions. I'm really excited about the breakout sessions, just as an opportunity to have in-person discussion, write some things on easel pads and Post-its, and it's just something we haven't been able to do in so long. So I really hope y'all are able to stay for those. We have 3 sessions, and they are designed to align with those 3 presentations. So they're an opportunity to really dig a little bit deeper, discuss those initiatives, and the things that we talk about in those rooms will inform the future of those projects. So the first session, which Natalie will be facilitating, is related to the HEAL initiative and talks about employee retention of those HEAL hires. She'll talk about that in a moment. The second one that I'll be facilitating will help inform our nursing assistant program, and that is all about how we can improve job quality and career pathways for nursing assistants. And then finally, we'll have a breakout session around how we expose young people to career opportunities in healthcare, and that'll be facilitated by Anna Yankelev, who you'll meet in a moment as well. Anyone can join any of those breakout sessions. You can choose which one to join. Whether you are an employer, a training provider, a community partner, those are designed for everyone to participate. One little request before I hand it over to Natalie. Employers, we have a new MOU that I talked about in the last quarterly meeting, and I may have emailed you specifically about signing that. I have collected, I'll say about 35 to 40% of those, but I still need a bunch back. So please sign those MOUs. If you have no idea what I'm talking about, feel free to email me about it. And then whether you are an employer or a strategic partner, I would love your logo because I am refreshing our website. I know I've said that before. It's been a long process to get this new website up and going, but it's going to happen this summer, and I would love when it launches for it to have your beautiful logo on it. So please send me a high-res logo at your earliest convenience. And with that, I'm going to hand it over to Natalie Rosado, Natalie, I wrote your title down over there and then I forgot it. But I'll let you introduce yourself. She is from Rush, and she helps lead the HEAL workforce working group. And she'll also introduce herself. Thank you, Natalie.
Hi, everyone. My name is Natalie Rosado. I am Assistant Manager of Information and Engagement at Rush University Medical Center. I'm really excited to be here today to talk about our HEAL initiative, but before we get there, I want to introduce Clara Saul, so she'll be kicking us off with an introduction about the HEAL initiative, what it is, and how far we've come since we started it. So Clara Saul Duque, she serves as the State Director for the U.S. Senator Richard Durbin. In this role, she serves constituents across Illinois and manages all aspects of Senator Durbin's office operations and personnel. She works on a wide range of federal issues, including immigration, healthcare, education, transportation, and infrastructure. Clara Saul's focused on serving the needs of all communities in Illinois by working closely with community-based organizations, businesses, advocacy, and civic groups, and partnering with elected officials and leaders at all levels of government to achieve tangible outcomes. In 2018, Clara Saul led the launch of the Chicago HEAL Initiative, which is a hospital engagement, action, and leadership initiative, a collaboration between Senator Durbin and 10 major Chicago hospitals to reduce violence and improve health. The Chicago HEAL Initiative addresses the root causes of violence through 4 main areas of impact. So it's economic strategies, community engagement efforts, clinical practices, and data sharing among hospitals. The Chicago HEAL hospitals have committed to advancing these efforts in 18 neighborhoods on the west and south sides of Chicago. In addition to serving as a community advocate in her professional life, Clara Saul is on the board of directors for the Big Shoulders Fund, the largest scholarship provider in Chicago. It partners with dedicated individuals, families, foundations, and corporations to ensure that children have access to a quality, values-based education. Clara Saul is a former member of the City Colleges of Chicago Board of Trustees, where she served as secretary of the board Administrative Services Committee. The City Colleges of Chicago is one of the largest community college systems in the nation, serving students at 7 colleges throughout Chicago. A Chicago native, Clarissa was raised in the Humboldt Park neighborhood. She's a graduate of the University of Illinois at Chicago. She's an avid runner and has run 13 marathons, including the 2022 Boston Marathon and the 2022 NYC Marathon. She lives in Chicago with her husband and 2 children. I'd love to welcome Clarissa to the stage.
Thank you so much for that lovely introduction. It's a pleasure to be here with you today. As Natalie mentioned, I'm Senator Durbin's state director and have been in that role for a number of years. You know, it's unique to find myself in this situation where I get to speak with the people who are working through the various goals that we have set through the Chicago Heal Initiative. It's a real honor for me to be here with you today. More or less around the time in 2015, the Chicagoland Healthcare Workforce Collaborative was starting off, Senator Durbin and I embarked on what I would call a bit of a tour to try and get to understanding why we were facing such a large increase of gun violence in Chicago. It was about 2015 when Senator Durbin asked me to put together a meeting for him to visit the juvenile detention center here on the near west side. Senator Durbin sat in a room with some of the leaders there at the juvenile detention center, and then had an opportunity to sit down with about a dozen young people who had been in detention for anywhere between 6 months to 2 years, and got to talking to them about what had happened in their life to lead them to be there. Afterwards, he realized that the vast majority of the youth who were at the juvenile detention center, in fact, 82% of them had either been a victim of violent trauma or had witnessed violent trauma growing up. That started Senator Durbin on a path to understand trauma, the impact of trauma to communities, the adverse childhood experiences in a child's life. We started to visit with local communities and often heard the comment of, you know, there's nothing that will stop a bullet more than a job. And as we were traveling across the city at community-based organizations, local churches, schools, we really started to connect the dots. There was something happening that we were not quite addressing in communities. There was these individual efforts here and there, but there was not a real well thought out collaborative effort. And so in January of 2018, Senator Durbin invited the CEOs of the 10 largest hospitals in Chicago, the leading here in Chicago, to have a conversation about the state of gun violence and the impact into health in communities. And it was clear that there was an urgent need for us to act. And so from that meeting, there wasn't a federal mandate that Senator Durbin set out to put in place that, you know, mandated certain things the hospital should do. Really, it started a conversation with the leaders of our hospitals who, as we all know, we are so fortunate to be in the city of Chicago. We have the best healthcare in the nation. We know that if there is a person who is a victim of gun violence, that they will come into one of these hospitals, and thank goodness, as a result of the incredible job that our healthcare systems do, most of the time people will survive. The question is, will they thrive, right? And so in 2019, early 2019, we had worked through 2018 to come up with 16 tangible goals that the hospitals set for themselves. And the senator wanted 2 things in addition to working together collaboratively. He wanted to set a timeline. He didn't want this to be an open-ended project. And so we agreed on a 3-year goal to meet these 16 specific commitments. Second of all, he wanted it to be transparent. And so we worked with the Illinois Health and Hospital Association to make sure that there was going to be annual reports that would highlight the effort and speak about the progress that we were making. And so the initial Chicago Heal Initiative was set out for 3 years. So that was 2019 to 2021. And in those 3 years, I think all of us understand what occurred. We had a global pandemic, but notwithstanding a global pandemic, the 10 hospitals worked diligently to meet the goals. We talked a little bit, and I know Natalie's going to go into some of the history in terms of the 16 commitments, but generally speaking, the commitments fell into 3 general areas: community engagement, economic vitality, and clinical practices that would address the issues of gun violence and health disparities. And so at the end of the 3 years, having withstood a global pandemic, Senator Durbin returned to the 10 hospitals and asked, where do we go from here? And without skipping a beat, the leadership of these 10 leading hospitals said, we want to continue to do this. We understand that we have more work to do. And so I come to you just a few weeks after our year 4 report has been published. And so I hope you will have an opportunity to take a look at it, because we really have a great story to share here with you. Last year alone, in 2022, the 10 hospitals partnered with 229 local organizations and offered 103 different programs to students. This is both at the Chicago Public Schools, K through 12, but also community college and other college students as well. They were able to, the 10 hospitals together were able to serve 212 schools in Chicago. And again, as Natalie mentioned, the focus is very specifically on zip codes on the south and west sides of the city of Chicago. I talked about clinical practices, the things that we know hospitals do well within the community. These efforts have been outside of the community, really engaging really where people are at. But notwithstanding the clinical practices, knowing that trauma recovery in particular makes a real impact in communities, I can very happily report that the 10 hospitals have served 17,000 patients with violence recovery programs, including 3,000 who've received intensive trauma-informed case management services. Unfortunately, we know that if you have been a victim of violent trauma, specifically a penetrating injury, that you are 50% more likely to return with a second injury. And we know that these trauma recovery services reduce that quite greatly. In fact, we had seen a recent report out of the University of Chicago that demonstrated that people who had received these violence trauma recovery their cohort saw only a 5% re-injury rate in a span of 5 years. So the initial information is really, really encouraging. And lastly, the reason we're here today to talk about workforce development and your work, we know what the pandemic did to our hospitals in terms of workforce. We know that there is widespread shortages in almost all areas: doctors, nursing, everything from a transporter, cafeteria workers, everything from your entry-level position all the way on up to medical doctors. And we know that not only recruiting, but retaining good these positions have been a challenge. And despite that, the 10 Heal hospitals hired 5,390 people last year from neighborhoods facing the highest rates of violence and poverty. So again, we have a lot to be proud of. And as we've entered the second 3-year part of the Chicago Heal Initiative, we know that it's efforts like the Chicago Healthcare Workforce Collaborative that will allow us to meet our goals. So it is a pleasure to be here with you today. I congratulate you for being back in person today for the first time since 2019. I know it makes a difference when we come together, and it really is, it really highlights that for us in the Chicago Heal Initiative, the partnership with the hospital, it's the collaboration and the deep partnership that we have with each other, the senator and the hospitals, but with community. So thank you so much for being here today. It's a pleasure to be with you.
Thank you so much, Clarissa. So really quickly, I'm just going to build on the foundation that Clarissa laid out for us, but wanted to talk a little bit more about what HEAL 2.0 looks like. So we had a lot of success in the first 3 years of our initiative, achieved our goals. And you saw in the previous slide that we really we set out to really increase procurement, increase workforce development as part of this initiative. And so as we were thinking about the next iteration of it, as Clarissa mentioned, all of the hospitals really put their heads together to figure out how can we really dive down on the parts of the commitment that we're doing really well in, and that we can at least double down on our efforts and make them more focused. So what we went ahead and did is narrow the 16 original commitments to 4 focus areas. So you see those right here. Essentially, we wanted to coalesce all of the different commitments that we had into 4 areas that could allow us to double down our efforts, and also assign working groups that would be in charge of achieving the goals for each of the focus areas. So all of these focus areas are aligned with specific violence prevention funding opportunities, and they're delivered together. You'll see that we have the Violent Injury Data Sharing Project. So part of what Clarissa was mentioning in terms of all of the hospitals coming together to share data about penetrative injuries so that they can work together to address issues related to that. We have our post-injury trauma recovery programs, we have school and community-based prevention programs, and then we're here for the Healthcare Career Pipelines Working Group. For workforce development, we targeted a 10% increase in HEAL zip code hires. So again, HEAL zip codes are on the south and west sides of Chicago, and a 5% increase in career pathway participants. So we deliver quite a few programs together as institutions, and we want to make sure that as we are delivering the programming, we're increasing the number of participants that are taking part in those programs. And then we're going to continue to collect targeted metrics for annual reporting. One of our big goals this year, with the pandemic in mind, was to think about how we can retain workers. And so that's going to be the focus area of our breakout session. I think all of the hospitals that are part of HEAL have thought about it. We've talked about it, but we're still trying to figure out ways to really double down our efforts on retention, figure out which metrics to track to really assess efficiency, and think about how this can aid just a larger HEAL initiative and our goals. And so we're excited to talk about that and have just a larger conversation of what it could look like for all of the hospitals. I know that it's so tough with a lot of these high demand roles. A lot of times we're recruiting from the same applicant pools. And so I think the conversation is really geared to figure out how we can team up together to recruit around these roles and have more concerted efforts to do so efficiently and in a way that really aligns our workforce practices, institutions, and the ecosystem. Just some highlights and results really quickly. So you'll see here that as a collective, we administer over 50 career pipeline programs. We've hired nearly 5,000 employees for our target zip codes in Chicago South and West Sides. We've served over 4,000 community members, students, and employees annually with our workforce development programming. And we employ as a collective a total of 15,468 individuals from HEAL zip codes. So really big numbers. I think that as a collective, we are doing a lot on the South and West Side as it stands, but there's a lot to do in terms of aligning our efforts and making sure that we're communicating and collaborating. And so we're excited to be here today and take part in this conversation. That is it for me. Are there any questions or thoughts before I hand it over to April?
Do you provide any supplemental services for the folks that are hired with this program as far as case management for themselves or other, barrier reduction services?
Right now, everything is really kind of within the hospital institutions themselves. So we all provide these types of services in some way, or we partner with community organizations to do so. I think the challenge is knowing what is available sometimes to a lot of these employees and knowing what all of the hospitals and the collective offer. And so one of our biggest initiatives as part of HEAL and our next commitment to HEAL was taking inventory of all of those. And so we do have an inventory of what kind of support services we provide, what kind of pathway programming we have. And what we want to do is make that available so that people know about it. So it's part of our initiatives to just make employees more informed. But it's really, it lies with each institution separately.
For the first one, 50 career pipeline programs, were these existing or were these new ones that were created or a mix?
It was a mix. So these are mostly existing. However, each institution will add in probably one or two every year. I mean, it's really evolving depending on the needs of the institutions, but these are 50 separate types of career pathway programming, just programs and initiatives that all of the collective institutions have. So it's a pretty big number, and I would say it will probably grow by the next time we do our next report.
Do you have any information on retention rates from all the hires that you have?
Not yet. So that is the goal. I know that a lot of the institutions, like I know at Rush, we collected, Northwestern collects this. So we have a lot of the institutions already collecting retention rates. Our goal for this iteration of HEAL is to set a goal and have some, some sort of guiding light in terms of how we want to do for retention. And then hopefully we would want to see that across the spectrum of different roles at each institution. But so not yet, but part of the breakout session, we're hoping to start the conversation around what that could look like and how we can set goals for the future.
I wanted to share something that just this conversation, the first iteration of HEAL was really what are each of the 10 hospitals doing individually, just inside their hospital. This is what Rush is doing, this is what UChicago is doing. And really iteration number 2, and this goes to Natalie's point of setting certain goals, it's really about how we do it together. And I think that's the biggest difference between HEAL 1.0, if you will, and HEAL 2.0, that it was like, okay, you do it on your own and then let us know what you accomplished at the end of that year, versus really, and when you think about doing this together, 10 very different institutions that by nature are competitive. It really, one thing I didn't mention is that it's become a national model. Senator Durbin has taken this, not only to the US Senate, but straight to the president. The CDC has recognized this as a model across the country, but it is not easy. To bring together 10 very, very different institutions, some academic, some are level 1 trauma. It's just very, very different institutions to do it together. And by the way, I would say it is a model. We are not sure where this is going to take us, but setting the goals in HEAL 2.0 is very different than what we did in 1.0, because it was collaborative, but there's much more of a partnership now.
I have a question for follow-up on that, Claricel. It's great to hear. I'm wondering if Senator Durbin is hoping to engage some sort of feedback loop where, is he looking for information that informs policy proposals or funding, and this more collective phase of HEAL? Are there bigger things that he's hoping might come from those learnings? Is there some way of bringing all these hospitals together to talk about those? And if yes, if no, is there something that CHWC could do to support that?
Thank you, April. That's a really good question. Absolutely. The answer is yes. I think the first iteration of HEAL really gave us an opportunity to understand really what is it that we're trying to accomplish. It's the first time we've kind of come into a room specifically around a conversation of addressing gun violence and health disparities. What we've seen in the last, I would say in the last year, is we at Senator Durbin's office have gotten smarter about what the hospitals are doing and how they're partnering, and we want to encourage that. And one of the ways that we've been able to do that is that, lo and behold, we have had the opportunity to do congressionally directed spending. And while the senator has done an incredible amount through massive pieces of legislation, like I'll give one example, which is the bipartisan Safer Communities Act, which was the first piece of, I would say, gun violence legislation that the Senate, that the Congress has passed in decades, provided an enormous amount of dollars for schools to address mental health issues. And that's something that we had been working on for quite some time, but the timing again around these types of collaboratives was key to inform that legislation. On the congressionally directed spending, we've been able to already fund some partnerships between hospitals. Rush and University of Illinois Health Systems has gotten funding through Senator Durbin to increase the number of school-based health centers. And that is, this is two institutions coming together with one goal. That is unique that we've done that in the last year or so. We've done also through workforce development. We did a project at Advocate that we funded now, I think now for 2 years on that. We would be very open to the idea of a proposal from the collaborative on what you think is the next, sort of partnership-based effort that could really make a significant impact. Now, there in the federal budget that we talk about billions and millions, what this congressionally directed spending can do is really take something that you've already proven to be successful and get it to that next level. It's not going to be, it may be somewhere between $500,000 and $1 million. It won't be millions of dollars, but it really helps move along something that already has some track record of success and move it along further. Sometimes you need that next level of funding, and then hopefully you'll get other avenues. But we would be very, very open to that conversation, and would be happy to sit down with a key group of folks once you identify the areas. And again, Natalie put up the 4 different areas, but I think a lot can fall under that. Thank you, April.
Amazing, thank you. Any more questions about Hugh? Okay.
Thank you.
Thank you so much, Clarissa, for being here. Thank you, Natalie. Thank you. Well, that was, I'm very excited to hear all of that. So Natalie's going to be leading this breakout session focused on employee retention of HEAL hires. That discussion will directly inform the metrics that that HEAL working group decides to track around retention. It will be a conversation about your challenges and opportunities with retention. I think that anyone in this room, no matter where you sit in the ecosystem, can have something to say about that. So that's one of our breakout sessions. And I just want to thank you both for bringing this here. I know that there are lots of great initiatives going on in workforce development, in healthcare in Chicago, and we all have different, we come from slightly different perspectives. We have different resources, different strengths and talents at our table. And I love the chance to sort of bridge the gap and bring them together and really leverage each other's assets. So I would love to, continue to have this conversation with HEAL, and if there are, there's dialogue that can help inform that initiative, inform anything that Senator Durbin wants to pursue. I would love to have CHWC be a space for that. So thank you again. Any final questions before we move on? Okay. Now we are going to move on to the Good Jobs Challenge grant. Raise your hand if you know what I'm talking about. Good Jobs Challenge grant. Okay. Raise your hand if you don't, or maybe it sounds familiar, but you need a refresher. Great. Okay. So the Good Jobs Challenge grant is a large grant out of the Economic Development Administration. The goal is to provide access to high quality jobs that include good pay, benefits, and career mobility for Americans who need it most. We are one of 35 successul grant applications across the country. So the awardees stretch across the 50 states. And we are part of a group of applicants. So the Chicago Cook Workforce Partnership which is the organization here that distributes most of our federal workforce dollars. They're also a nonprofit. They are the lead grantee on Chicago's winning application. We are the Chicago Healthcare Workforce Collaborative is one of several different organizations or sector partnerships that are part of that award. It is a 3-year grant that goes through August 2025, although spending is permitted through the end of 2026. Health is one of 4 sectors on the grant, and Health and Medicine Policy Research Group is the health backbone organization. Ani Yankolev is here from Health and Medicine. She's gonna, in a little bit, she's gonna say a little bit more about what that organization does and what the Public Health Workforce Collaborative does, which is also housed in Health and Medicine and our sister sector partnership on this grant. There is around $4 million in training funds specifically for the health sector to be split by our collaborative and the Public Health Workforce Collaborative. There are also additional funds that support staffing up and capacity building costs outside of that $4 million. So it is a large pool of funds for us to use. This is the graphic that the Chicago Cook Workforce Partnership put together for the application. You'll see them at the top as the system lead entity. And then there are 4 sectors on the grant. So health has us, the Chicago Healthcare Workforce Collaborative, also the Public Health Workforce Collaborative, whose logo isn't up there. And the other sectors are IT, manufacturing, and transportation, distribution, and logistics. There are also some support organizations that have some funding through this. LISC Chicago, Women Employed, World Business Chicago, that is the mayor's workforce development arm, and NEWS, which is the Network of Employer-Led Workforce Solutions. That is a project out of the Chicago Workforce Funder Alliance. And I'm just spewing acronyms at you, but that is a table where all the different sector partnerships get together and support each other. So this is what that grant looks like. The Economic Development Administration chose sector partnerships specifically as their vehicle to support good job development. So a sector partnership is what we are, an employer-led collaborative, where the employers are the ones coming together in a specific region to say, these are our collective needs, and to work together to solve those needs. So the grant from the EDA supports system development for those that don't already have sector partnerships. So in Chicago, transportation, distribution, and logistics is building a brand new sector partnership. Manufacturing is building a second one. IT is sort of building one as well out of Q3. But we are lucky that we have existed since 2016. And so we check, we're done with system development, which is phase 1. And we are now on phase 2, which is program design. And that is where we are deciding what kind of training programs we want to use this funding to support. We're hiring additional staff and consultants. We are designing our programs and recruiting our partners and getting our MOUs together. And then there is a step where we will submit a detailed program proposal to the Chicago Workforce Partnership to just gain their approval and sort of set up the contracts for reimbursement. And then phase 3 is program implementation. Each of the different sectors and sector partnerships are addressing program design and program implementation in different ways. We, as the CHWC, are starting off by pursuing, truly collaborative models. We want to see if we can bring all of us, not every single partner probably, but most of our partners together under a single model, and really uses this as an opportunity to push some systems level change. That being said, there may be other phases down the line later this year, next year, where we can open up some additional funding to fund some smaller programs. And so I'll keep you updated about that as it progresses. We have hired a pathway program coordinator, Sasha Ontenko. So we're in that hiring more staff and consultants phase right now. Sasha wishes she could be here, but she is on a plane right now. She is a workforce development contractor who specializes in training and development facilitation. She is great at program design and implementation. She's done a lot of pilot projects, and she has spent 11 years at Cara Collective. I don't know if you know Cara Collective, but that is a workforce development organization here in Chicago, where she led and supported strategic community engagement. She led their social enterprise arm with their staffing firm. And she's done a lot of work with employers and some of the employers at this table. So hopefully you'll get a chance to meet her soon if you haven't already. And she is taking on the original design of our first program that we are funding with the Good Jobs Challenge Fund, which is a nursing assistant pipeline and pathway program. And we've come to the decision to pursue this particular program over a series of meetings and over under approval by our steering committee. This is where we are putting our focuses right now. It doesn't mean that this is everything that we're going to do with our Good Jobs Challenge funding, but this is what we're focusing on right now. So if you see on the left-hand side there, the sort of pathway that we're pursuing, we are training people to become nursing assistants. Many of those are probably going to be outside hires, but it could also be for incumbent workers. And then we are also funding upskilling and advancement for nursing assistants to move to that next level. What this model does, and this is sort of a hub model, so it's going to strengthen and expand existing programs. Many of the partners that are here, as well as who couldn't make it today, already are doing nursing assistant pipeline programs in partnership with each other. So I know we have groups of employers that are working with specific training providers and specific community organizations to target a specific population, put them through a funded training model, and are onboarding them to become nursing assistants. That's already happening. And we want to apply this funding to help continue those programs, make sure that they can continue, especially those where the funding is running out. So we're going to strengthen those, we'll expand those with this funding, and we're going to allow our employers to maintain those customized models that they've already built and keep working with those partners that they've been working with and that's working for them. And the new thing that we're going to add is this sort of umbrella hub model. So what we're asking for those who want to come under this nursing assistant pipeline and pathway umbrella from CHWC is come to our community of practice, share what's working, share what's not working, share your resources where appropriate, participate in collaborative problem solving. Let's have real system-wide discussions about job quality for nursing assistants, about career pathways for nursing assistants. You know, if one employer is doing something and made a change where each participant has an in-house mentor and it has changed the success rate of the entire program, share that. Let's replicate it elsewhere. So we're asking you to join the community of practice. And the other thing we want to do is introduce program interventions that strengthen job quality and career pathways. So we'll design those together. We want to, come together, and we're going to start doing that in the breakout room today. We're going to come together and ask, what are small things or big things that we can do at each stage of this job trajectory to help nursing assistants succeed and to move and to stay with your institutions and to move and advance up a career pathway. So within that umbrella is the funding. We will be doing some data and evaluation. EDA will require that, so will the partnership. We will convene that community of practice, and we'll also be creating some shared resources and implementing those program interventions. So why come and join the Nursing Assistant Pipeline and Pathway Program? It's access to capacity building funds to improve the existing programs. We will also help launch new programs. This isn't just about existing programs. It's a chance to strengthen and improve the training, the job, and the pathway experience. We're going to incorporate CNA. We're going to incorporate input from alumni from those programs and ask them directly what worked well, what are your career goals, What's allowing you to get there? What are your barriers that are stopping you? And yeah, we're going to support CNAs through that upskill into another role. So like I said, we have about $2 million to invest because there's $2 million that the Public Health Workforce Collaborative is going to use. That could be entirely for this program. It could be training nursing assistants and supporting upskilling of nursing assistants. I recognize we might not, reach the, the capacity that will get us there. And in that case, we will add additional programs, but we could invest up to $2 million in this. And we do have a goal that is stated in this grant to train or upskill 150 nursing assistants through 2026. And I know that this is hard to see. We are going to send out these slides with the recording. But this is sort of the framework that we're going to look at when we're thinking about what are these interventions? What are we going to do to strengthen job quality and to improve career pathways? We're going to look at each stage of the participant journey from discovering and discerning, from candidates coming and thinking, maybe I want to be a nursing assistant, or you going out and doing outreach and saying, come and be a nursing assistant. From that phase to training and upskilling, when they're in the education program, when they're taking their certification, to hiring and onboarding, and then finally to retention and advancement. And this is the framework that we're going to be looking at in the breakout room today and asking, what are the opportunities and challenges at each of these stages, and where could we pursue some potential interventions? This is the rough timeline for the entire grant. So right now we're in summer, fall 2023, definition and planning. We're identifying our first round of programs to come under this umbrella. I've already talked to, I think, 4 of our existing programs, but you might have a program that exists and I haven't been talking to you yet. So please let me know if you want to come under our umbrella and you want to have those conversations. We're setting up our, program sort of infrastructure and resources. We're co-designing the interventions, and then we'll begin recruitment for our first cohorts. And I should say, just to go back really quick to this, and I know this is difficult to see. You can see under this umbrella, here's Model A with its own employers, its own partners, its own specific target population, its own schedule. You can keep, if what you're doing is recruiting West Side residents, you want to tie this to your HEAL goals. You want to recruit people from specific zip codes. That is fine. Keep that. Keep it on your own schedule, your own cohort size. If you are targeting young people, that is fine too. So you can keep your own models and come under this umbrella. So towards the end of this year into next year, we're hoping to launch those cohorts, launch our interventions, establish that community of practice. I'm really asking you, if you want to join this, we need you to share. I know that a lot of things are proprietary and there's some sort of data that you might not want to share with your competitors, and we'll make space for certain limits to what you're asked to share. But that community of practice is really important. And we'll also be identifying additional partners. So into next year, we'd love to help those employers, those partners who are not involved in a current project, to help you build a project as well, building on what we've learned from the existing models. We'll constantly be analyzing our outcomes. We'll be asking our participants to give us feedback. I know Sasha is interested in doing sort of an alumni consulting sort of board. We'll iterate on those models. We will really begin supporting advancement. Hopefully that will actually happen before this. And then, through the end of the grant, we'll keep iterating, keep, hopefully supporting advancement into new roles. That could lead to some very specific models. Maybe we see that a lot of people want to become RNs and we start supporting that specifically through a cohort model. I don't know. Sky's the limit. And then hopefully, towards the end, we'll be able to evaluate the sustainability of this hub model, seek new funding from friends of ours, perhaps. And we'll we'll have learnings to share with the entire industry. And so I'm going to ask for questions in just a second. I'm sure you have some, but this is what we're going to talk about in our breakouts discussion is how might we improve job quality and career pathways for nursing assistants? Again, whether you're an employer or anywhere you sit in the ecosystem, I'm sure you have something to say about this. And this discussion will be the first of many where we think about what kinds of interventions can we focus on with our Good Jobs Challenge program to increase job quality and improve career pathways. Questions?
The 125, that's your goal annually. Where are you at with that now?
So I think it's 150 for the entire grant.
Okay,
So through the end of 2026.
okay.
And right now we're at 0.
Does that include?
So we haven't launched yet, but there are these existing programs that have been, training nursing assistants. What we want to do is help fund those programs with this Good Jobs Challenge funding, expand them, and then yes, those nursing assistants would be counted towards that 150 goal, but we haven't started yet.
What about medical assistants?
So we haven't decided to focus on medical assistants for this grant yet, at least. It's not saying that we might not get there in the future, but we're looking at nursing assistants for now.
How long does it take to train a CNA?
It could be 9 weeks. It really varies.
We're doing
For those who train CNAs, how long are your programs?
we're doing a 5-week one.
5 weeks?
Yeah.
It really depends. Yeah.
8 weeks.
8 weeks.
Oak Point has one for 4 weeks.
4 weeks at Oak Point.
Right, yeah.
So it's a pretty short-term certificate.
It's intensive.
4 weeks does sound intense.
Is there a common definition of what that job is?
That is a great question, and something I would love for that community of practice to talk about. I know something that I am still confused about, and I've only been with this collaborative for a couple of years, and I was new to healthcare. What is a patient care tech? And versus a CNA versus a what do you call them at UCM? An NSA. There are so many different titles. I'd love to have that conversation. Is there a real reason behind the difference in these titles? If we look at what different hospitals are doing and what certifications they require, is there a real difference in pay, in ability to advance? That's a conversation I would love to have in this community practice.
I have a question that's larger. When you were building out this grant, did you look at, for the career pathway especially, did you look at other institutions nationally that have done CNA through RN and seen what was successful and tried to work some of those? Because having worked outside of Chicago for more of my career than inside Chicago, it is definitely a common practice in other areas that I haven't really noticed as much here.
I would love to talk to you more about that. Yes, one great thing about the Good Jobs Challenge grant is it puts our collaborative in touch with so many other different collaboratives across the states, some of which I've already invited into our learning events to present. Last year, we heard from a really interesting CNA to LPN apprenticeship model in Syracuse, New York. So I'm constantly trying to learn from what's happening in other places in the United States. And there is a community of practice specific to healthcare that is part of this Good Jobs Challenge grant. We're having our first meeting, I think, this month or next month. And 33 or 35, I'm forgetting, % of the total jobs that are projected to come out of the Good Jobs Challenge funding are in healthcare. So there are so many different places across the United States who are doing similar work, obviously facing similar challenges. So I'm excited to learn from them, and I would love to hear more about what you know. Are you going to tell us how to do it?
I don't know how to do it.
One of the earlier slides, another sector that's being focused on is IT. If many of us have IT within our systems, is there an opportunity to participate in those, or is that not, in this conversation?
Another great question. I want the answer to be yes. I still have to do some work on the back end to figure out how to loop them in. I think we're still at a stage with the partnership and with the other sectors of sort of getting the frameworks in place, getting on the same page. It is clear that these sectors are very different. They have different needs. The sector partnerships themselves act in very different ways. I know it's been challenging for the Chicago Cook Workforce Partnership to figure out how to design the inner workings of this grant in a way that's going to work for each of us. So we just started meeting as an entire group and started sharing what we're thinking about doing. I know that P33 is working with one particular training provider, Discovery Partners, I want to say. Long story short is I really hope that I can, update all of you on what the other sector partnerships are thinking about doing. Share, I know there are organizations, there are training providers here who could easily tap into those other sectors as well. And I would love to facilitate that, cross collaboration as best I can. But I don't know exactly how it's going to happen yet.
Well, that's the beauty of healthcare, is that many people don't understand that we have lots of different sectors that we can help train and employ down the road. So I guess just keeping that in mind, because even I think you mentioned the supply chain, and that is definitely another need. So I would be interested in hearing, because we do want to support those in our organization.
The TDL portion of the grant, they're the sort of they're the newest sector partnership that's being formed. The lead entity there is Olive Harvey. There's someone else there.
YWCA.
And YWCA, thank you. So anyone can feel free to reach out to me with some very specific questions. I'm happy to introduce you to the folks who are running those tables, who might be able to give you information a little bit faster.
Perfect. Thank you.
Yeah, no problem.
April, do you remember what the total grant amount was for the whole Good Jobs?
For the entire thing, I think is about 18.5 million.
And healthcare is getting 4?
So there's a training bucket, a bucket of funds that is for training that the Chicago Cook Workforce Partnership will be doling out. Of that bucket, 4 million goes towards healthcare. So there's this other, bucket that is supporting. So health and medicine has a separate contract that's paying, for part of Anna, part of me. We're hiring Sasha. We're hiring a youth pathways coordinator, which you'll hear about in a moment. But so the staffing costs, some things under that are like marketing. There's more funding that's going towards healthcare, but the 4 million is specifically the training dollars. And so that can cover tuition, but it can also cover supportive services, uniforms, transportation. We can contract with community organizations to do case management and recruitment and do all kinds of great trainings.
It cannot cover stipends.
Thank you, Anna. Yeah. The only thing it can't
Very
cover
important caveat.
wages and stipends of the participants. But you can. Any other questions? I know some of you I'm already talking to specifically about the nursing assistant pathway. If you're interested in having conversations at this stage as well, please reach out to me. I have it on my list to reach out to some of you. Look at my health, yeah. And I'll keep you updated. And yes.
So since CCWP or Chicago Cook Workforce Partnership is the grantee, would it be not allowed for us to partner with them? Because I do know you said that stipends and wages are not covered, but they do have OJT dollars.
which could enhance that training, and they would cover that? Or would that be considered double dipping?
No, they want to help us figure out how to use WIOA dollars, OGT dollars to cover things. They are careful about double dipping, but just as long as you aren't vouchering for the same costs on the two different funding sources, I think that's good. We're working out the sort of budgeting and reimbursement process with the partnership right now. I'm trying to do just like the simplest thing possible. Yes, the partnership wants to help us figure out how to use WIOA and on-the-job training dollars to support these programs. Any other questions? Okay. The breakout discussion on nursing assistant pathways is going to be in this room. That's how might we improve job quality and career pathways for nursing assistants. And with that, I'm going to move on to our final updates today, which is on our Youth Pathways Committee. This committee has been around for about 2 years now. They are focused on exposing youth to career opportunities in healthcare. The logos on the left just describe some of the partners at the table. We have a variety of our employer partners, as well as training providers like CPS and city colleges, and community organizations at the table. That committee has created a searchable Youth Pathways directory that lists all of the different internship and career exposure programs provided with those organizations. And we've hosted several virtual events, info sessions for high school students on those programs, as well as some larger opportunity showcases for college students that expose them to opportunities, as well as panel discussions and job highlight series to allow them to see the diversity of quality job opportunities in healthcare. Our next big task out of this committee is our Speakers Bureau campaign. So Health and Medicine Policy Research Group runs one of the 2 area health education centers at the national project. And they are one of 2 in Chicago that run an area health education center with federal funding. And that AHEC center runs a Speakers Bureau. So the Speakers Bureau links professionals that represent diverse health careers, everyone from nursing to doctors to those in public health and psychology. I know there are some dentists and veterinarians on that list, occupational therapists. And the whole goal is to get those speakers in front of students to help inform, motivate, and empower them to pursue attainable health career goals. So that bureau that is run by Health and Medicine, they maintain a roster of interested guest speakers. They go through the approval process with CPS. And then when teachers or administrators contact the bureau, they then find a healthcare professional that matches their needs and the location and time requests of that teacher or school. This Speakers Bureau was to my understanding, there were a lot more people that were active in it prior to COVID. Now it has dwindled and they're just drawing on the same people over and over again. So we want to help, stack the bench of that Speakers Bureau with as many professionals as possible from diverse careers. So that's number 1 on our Speakers Bureau campaign, is recruit more speakers. So there were 36 before we started doing this. Our goal is to reach 70 by the start of the next school year around September. And we have already gotten to 45. So we have already been recruiting more speakers and getting more people in that list. We'd also like to increase the diversity of occupations, of people that are listed in that Speakers Bureau, so that no matter what teacher or class, no matter what their need, we can find someone to fill that very specific need. How are we doing this? We are marketing. I haven't even pulled them out of my bag yet, but I brought a bunch of our flyers to recruit speakers. I have a whole toolkit that includes flyers. Let's pass these around. Take a couple, post them up at your organization. Sorry. So I have flyers, I have blurbs, I have social media images. They have a QR code, so these can be posted on a wall and scanned. You can use an image and a blurb and a newsletter, any way that you get out the word internally, just to get people signed up for this Speakers Bureau. That would be great. That is our ask of you today. On the flip side, we also want to increase the awareness of the Speakers Bureau amongst teachers, schools, other organizations that get in front of children. It's not just limited to CPS. I know that CPS language is on this flyer, but the Speakers Bureau can also serve other school districts and other organizations. So we want to promote that this opportunity, and I have a whole set of marketing materials aimed at teachers and administrators for that purpose. And our goal here is to increase our speaking engagements fourfold. So there were 6 speaking engagements in the spring semester of 2023 that has just ended. We want to get 24 over the summer, and probably most of them will be in the fall in the next semester. So how you can help is by circulating this to healthcare professionals who might join the speakers, and also any of you who are connected to teachers in schools, help us promote on that end. So that is the current role of the current campaign of the Youth Pathways Committee. Any questions on that particular campaign? Okay. So through the Good Jobs Challenge, as we've just been talking about, CHWC is now supported by Health and Medicine Policy Research Group. So we used to be a program out of the Chicagoland Workforce Funder Alliance. We are now sort of moving over to our permanent home with Health and Medicine Policy Research Group. They're the backbone organization. They also host the Public Health Workforce Collaborative that Anna Yankelev, I'm going to invite her in just a second, runs. And they are hiring a youth career pathways coordinator to develop, implement, and track training programs and supplemental services for youth entering the health workforce. That will be stuff under the Good Jobs Challenge grant, but also take over this committee and coordinate the broader youth career pathway ecosystem, aligning relevant resources and services. So that job description is out there right now. We are looking for someone to take over and sort of build the capacity of this working group and help it better align with the Public Health Workforce Collaborative and things happening at Health and Medicine. I don't know, what's Health and Medicine? What's the Public Health Workforce Collaborative? We'll invite Anna Yankelev up here to share. Perfect segue. Good morning, everybody. My name is Anna Yankelev. I use she, her pronouns. I am the Director of Strategic Workforce Initiatives at the Health and Medicine Policy Research Group, and I'm also the facilitator for CHWC's sister table, the Public Health Workforce Collaborative. Perfect. So what is Health and Medicine? We are an independent health policy center that conducts research, educates, and collaborates with other groups to advance policies that promote health equity for all Illinois residents. Our mission is to build power and momentum for social justice and health equity. And we operate in a variety of different areas within that space. So I personally am on the workforce front, but we also have, we talked a little bit about trauma and ACEs earlier. We have a whole team that is working on trauma-informed Illinois. We have a team that's working on aging equity and making sure that Illinois is equipped to support our aging population and our aging workforce. And we also do various projects around birth and reproductive justice, around access to health care, and criminal and legal justice as well. So the Public Health Workforce Collaborative, as we've said, is the sister table to the CHWC. And whereas CHWC is primarily comprised of large health and hospital systems, the PHWC is more focused on non-clinical organizations, but also includes FQHCs and other smaller clinics, as well as behavioral health providers and other community-based organizations that do public health work. And we've seen over the last few years, especially, a huge influx in community-based organizations that
never really thought of themselves as health organizations. And then through the pandemic, through the work that they did around COVID education, vaccination, and mitigation, that they are realizing that a lot of what they do is in fact public health. So in the PHWC, we are looking at roles like community health workers, like behavioral health specialists, like crisis responders, violence interrupters, doulas, community researchers, community organizers. So looking at the other side of the health world, outside of the clinical space, who are all the people that help us understand and address some of the barriers to health that so many of our community members are facing. So you see the vision and mission for the PHWC on the board. But I just want to emphasize our 3 R's here, where we're talking about making a public health workforce that is robust. So not only do we have enough public health workers, but organizations understand and appreciate what public health does and the value that they bring to organizations and to the communities that they serve. We want to make sure that that workforce is representative of the communities that they're serving, especially in leadership positions. We see more diversity in our organizations, but we're seeing that diversity concentrated at some of the lowest paid jobs in organizations. And we want to make sure that we are making a more equitable access to leadership roles in our organizations. And importantly, resilient. We want our workforce to be able to withstand whatever the world is throwing at us, whether that's a pandemic or a recession or the silver tsunami with the retirement of all the baby boomers. And to make sure that our public health, and I'm sure many people in healthcare have also felt this, that they have the mental health resources to help avoid burnout, to help make sure that they are able to take care of themselves so that they can take care of other people. So if any of you, I know that many of you are concentrated in the clinical space, but if your organization employs community health workers or other public health roles, I would love to talk to you. I would love to bring you into the Public Health Workforce Collaborative. We're taking a slightly different approach with Good Jobs Challenge funding because in public health, we don't have the same, hundreds of positions demands for CNAs like healthcare does. So we'll be doing more smaller targeted recruitment and training programs that will funnel people into, into more specialized roles within organizations. So there's a little bit more flexibility on our end, but we'll still be working with the Good Jobs Challenge and wanting to make sure that we are helping to connect people across the PHWC and CHWC. So if we have someone that, is starting as a community health worker, but they really want to move to become a CNA or an RN, that we have easy transitions across all of our different programs so that we're complementing each other and supporting one another in our work. And is there anything else that I should mention at this point, April?
No, just tell everyone what you're going to talk about.
All right, so we're going to have a breakout group session. The third breakout group is going to be focused on how we can expose more young people to career opportunities in healthcare. And I will just make one asterisk there. I'm going to say career opportunities in health broadly. So as April mentioned, Health and Medicine is hiring an individual that will be dedicated to building out career pathways for young people specifically within health. So that could look, and because we know that young people need special supports, they need special attention, and we can't just, throw them in a pool and expect them to swim with everybody else when they haven't been taught to swim yet. So I want to reiterate April's invitation to please, if you know someone that is looking for a job, to direct them to our Health and Medicine's website. We have the career posting up on our Come Work With Us page. And this person is going to be working full-time on this question of how we can help expose more young people to these careers. And I invite all of you to help us figure out how we can get that person started in the right direction. Thank you, Anna. We're about to take a 12-minute break. Please remember, employers, I want your MOUs. Everyone, I want your logos. Also help us recruit guest speakers and promote the Speakers Bureau. In the follow-up materials to this meeting, including the recording and slides, I will include a link to that entire toolkit. Let's have a couple moments for community announcements in just a second, and then I will put up this breakout session in instruction. We have 3.
The nursing assistant pathways is going to be right in this room. The HEAL employee retention is sort of behind us over there in the Pullman room. And then the youth pathways is on the other side of the kitchen here, through that wall in the Buckingham room. And I posted up some signs, and those will start promptly at 10. Just curious, who's thinking about going to HEAL employee retention? All right, who's thinking about going to nursing assistant pathways? All right, who's thinking about going to youth pathways? Okay, cool, awesome. I feel like the rooms are appropriately sized for that. That's wonderful. With that, anyone have something they want to share with the group very quickly before we go on break?
I just had a quick question.
Sure.
Is the model for the grant apprenticeships, or is it just
Not
training?
necessarily.
No.
It can be.
Can't be, okay.
It can be, but there's no, the EDA just wants the solutions to come out of sector partnerships. They want us to focus on good jobs. They have a lot more flexible funding for things like supportive services than usually come out of federal grants. But they haven't prescribed any particular training models.
Okay, thanks.
Anyone have something to share? Megan?
So my name is Megan Phillip. I serve as the Executive Director of the Healthcare Council of Chicago, HC3. We previously partnered with CHWC in February. You joined us virtually for our Future of Work discussion series. We are hosting our next webinar next Thursday, June 22nd at 9 a.m. And I will send this link to April to share, but I just want to flag it because we're going to be talking about hiring and sustainability. Someone from P33 who works on the Good Jobs Challenge will be on that. So she'll be talking from the IT. We also have someone from the ADA talking about dentistry and someone from the Nursing Association. So it'll be a different perspective, but I think it's just another way that we can continue the conversations and hear from different sector partners on what's going on. And that's the goal of the series. So I will pass that along.
Follow-up stuff.
Yeah, but I just wanted to flag it so that it's just, I remind myself and everybody holds all of us accountable to get that to you.
Anyone else? Okay, please go eat. Bathrooms are, out the door, down the corridor. Code is 998 pound. And then please be in the breakout room promptly at 10.
So I drank.